Hello, Pets Plus Us community. I am Dr. Jennifer Sperry, your veterinary advisor for Pets Plus Us, and I want to talk to you today about unlocking the full potential of telehealth for your pet. So first, let's talk about what veterinary telehealth actually is. So telehealth is actually a category of health services that use the communications technology like phones, video chat, texting, or email to connect pet owners with veterinary professionals so that they can get advice about their pet. And what this does is it allows people to find out information about their pets without having to physically travel into an animal hospital. So like I said, telehealth is a broad category, and under the category of telehealth, there are different levels of service. The first level of service that you might encounter is tele-advice. And tele-advice is when a vet or a vet technician provides general information about the care and health of pets. So it's not anything specific to your pet, and it's not the type of service you're going to access when your pet's having a medical problem. So examples of tele-advice would be things like, how often should I feed my cat every day? Or at what age do we usually provide vaccines for new puppies? So it's very general advice that can apply to all pets that might be going to the vet. The next category is teletriage. So teletriage occurs usually when your pet is having some sort of medical issue. And that's when you reach out to a veterinary professional to find out how soon do you need to get in to see the vet. So if your pet is experiencing a health issue like appetite loss, weight loss, skin problems, vomiting or diarrhea, common things that a pet might encounter, you may want to know, do I need to go to an emergency room tonight? Can I wait until my vet opens on Monday? Or is this something I can even wait until my next scheduled wellness appointment to discuss? And on a teletriage service, they're going to give you information about that sort of approach to your pet's health. And finally, the most complex or the highest level of telehealth is telemedicine. So telemedicine occurs when you have a specific question about your pet's medical condition, and you may be seeking a diagnosis, you might be seeking treatment advice, or even a prescription. This is going to fall under the category of telemedicine. So for example, if your dog is experiencing some diarrhea and you're looking for a treatment to be provided or some care advice to be provided that is going to happen without an appointment in the physical vet's office, that's going to be called telemedicine. So if you've decided to use a telehealth services for your pet's care, it might be important to know who's on the other end of that video chat or who's going to be on the other end of that phone line. So telehealth is usually provided by either licensed veterinarians or credentialed veterinary technicians, also known as veterinary nurses. These people are going to be able to provide you with both general advice about your pets, and then if you want specific advice under the category of telemedicine, you're usually going to be getting it from a licensed veterinarian. And that licensed veterinarian is going to have to be licensed in the area where you and your pet are also located. Now, sometimes it's your regular vet's office that is providing telehealth services. So it's going to be the people that you're familiar with who have a full file on your pet and your pet's history. Sometimes you may also choose to use a third-party telehealth service. So this is a service that is not necessarily affiliated with a physical practice, but they have veterinarians and technicians on the line to help you navigate your pet's health issue. So if you're used to having to go into your vet's office for any kind of advice or services, you might wonder what the reasons would be for using a telehealth service instead. One of the great reasons that especially we here in Canada experience are the distances that sometimes exist between pets and pet owners and their veterinarian. So you might not have a vet in town, but you might need the advice right now. So there might not be nearby vets, or If you're new to an area, your nearby vets may not be accepting new patients in the time frame for which you need that veterinary advice. Or you might have a vet nearby, but they have no appointments available. So there are not enough vets to meet all the needs of all the pets in our communities. So sometimes long wait times are a good prompt for using a telehealth service. You may also have transportation concerns. So you might not have any personal transportation to get you from your home to your veterinarian's office. The public transportation options in your community may not accept pets or the type of pet that you have, or transportation costs might add to the cost of caring for your pet. And so you may be looking for a solution to get that advice without having to incur that transportation cost. Convenience is often overlooked as a good reason for using telehealth. So convenience sounds like a luxury, but when accessing your veterinarian's office makes you need to miss work, it makes you need to wait a long time. If you have children that are going to need to be cared for while you leave and go to the vet's office, or if you have needs that are outside of your veterinarian's regular office hours, you may need to access telehealth. And we call this convenience, but for many people, these are necessary factors to consider. You may also have pet factors. So if your pet is very anxious or aggressive in the vet's office, you might be looking for a way to access advice without bringing your pet into the office. Similarly, if your pet has mobility concerns, if they're really big, if they're really heavy and they have a hard time getting up or getting into a crate or carrier comfortably, you might look for a way to communicate with your vet without having to bring the pet in. And then finally, there are cost concerns. So sometimes visiting a vet, again, like I said, there are those convenient costs like missing work, waiting, childcare, and after hours needs that may make you want to explore the cost savings that come along with telehealth services. So one big thing that pet owners often want to know before they contact a telehealth provider is, can I get medicine for my pet during a telehealth visit? So sometimes people are looking at their pet, they're aware of the condition that they're experiencing, and they're predicting that the pet may need medication to get better. Will telehealth be able to meet that need? And the answer is, it really, really depends. First of all, it depends on what kind of condition your pet has. Is it something that can reasonably be treated remotely? If it can't reasonably be evaluated and treated remotely, then a telehealth call may not get you the prescription that you're looking for. It also depends on who's providing the consultation. So if your regular vet is providing a telehealth consultation, they're going to have more ability to extend a prescription to you because they know more about your pet, and because they sometimes have more legal rights to prescribe using a telehealth service. If you're seeing another veterinarian who's never seen you in person, depending on where you live, there might be regulatory limitations that prevent them from giving you a prescription for your pet via telehealth. And then if the service you have chosen for your telehealth is provided by credentialed veterinary technicians, they typically do not have prescribing rights, so they might not be able to get you medicine for your pet. I touched on regulations, and so whether or not you can get medicine for your pet is going to depend on where you live. So if your veterinarian is located in Ontario and you're located in Ontario, there are some limited prescribing rights for veterinarians via telehealth, so they're allowed to do that. If you're in Alberta, you may not have the ability to get a prescription through your telehealth provider because the regulations prevent that. So, and that's mostly related to when you're seeing a telehealth provider that does not have a physical clinic where your pet has been seen before. So it's good to know what the regulations there are in your area, and you can ask your regular vet about that, or you can even ask your telehealth provider about that. Whether or not the condition is new or ongoing also has an ability to factor in here. So for ongoing conditions and you're getting a refill of medication, or your regular vet has already become very familiar with what's going on with your pet, they're going to have more ability to prescribe. But if the condition is new, the vet might not have enough information to get your pet the right medicine, and they may also come up against some legal restrictions in terms of prescribing medication for a new condition. So in the next section of this presentation, I'm going to talk about what you can do and how you can prepare ahead of a telehealth experience to get the most out of that interaction. Now we're talking about telehealth, so it might seem a little strange that the first step that I'm recommending is to make a relationship with a veterinarian in a physical animal hospital, but I'm going to get into why that's so important. The first thing to keep in mind is that not all conditions can be evaluated or treated remotely. So if your pet's experiencing an extreme emergency, they're having difficulty breathing, maybe they broke a bone, telehealth's not going to be able to do everything that your pet needs to get them better. So it's good to have a relationship with a vet that you can get into when those physical things need to happen. And when that happens, if you have a clinic in your area and you're not a registered client, if that clinic's really busy, you're going to be low on the list to get in because they have obligations to the clients that are already registered with them. So you want to get registered with a veterinarian in your area. And you also want that veterinarian to have a good knowledge of what your pet's health history is and what their current status is. So a vet that has previously seen your pet can do more for them also remotely in a situation where you only want to go remotely in. So like I mentioned earlier, there are legal restrictions to, in some areas, to what a veterinarian can do remotely, and they have a lot more freedom to give specific advice or prescribe medication when they've physically seen your pet before within a certain time frame. And finally, and probably the most important, is that a family veterinarian can track your pet's health history and their status and recognize trends that you will want to know about. So when you go into the vet physically, they take measurements of things like weight, heart rate, respiratory rate, their skin condition, what their mouth looks like. They take those measurements and make those observations at every visit. So if something is trending in a way that alerts them to a chronic issue that you need to know about in your pet, having a regular veterinarian who holds all of the records for your pet, including the records of when they had a telehealth consultation, that's going to allow you and your vet to work together a lot more efficiently to maintain or protect the health of your pet. The next thing that you want to do ahead of any telehealth appointment is to collect all of the tools you might need to share information with your provider about what's going on with your pet. So have all the tools that you might need ready in the room in case they ask a question or ask you to take some sort of measurement. So some of the things that you might need would be a thermometer, and you can use an ear or a rectal thermometer with your pet. Rectal is more accurate, but you may not want to go that way, and you can still use a rectal thermometer up in your pet's armpit to help take a temperature. You're going to want to have a list of all of the supplements or vitamins or natural health products or alternative products that you use for your pet or that you use in your home that your pet is exposed to. So if you're using any sort of vitamin or herbal medications, essential oils, anything like that on your pet, keep a list of that so that you can share it with your vet. You also want to take some photographs or videos of the problem that you're worried about. So if your pet's been limping or having seizures or breathing in a funny way, a video paints more than 1,000 words for your vet. Or if your pet's having a rash or maybe they have something weird going on with their teeth, a photograph can really help your remote vet understand what's going on. So they get to see through your eyes a little bit with that technology. You also might want to keep on hand a list of any groomers, trainers, or other people that help you take care of your pet. You want to have your pet's general medical and vaccination history. So you probably don't have your pet's full medical record on file, and that's okay, but you probably do know what your pet weighed at their last visit, what medications they're on, and when they got their last vaccinations. So have that on hand in case your vet asks about it. You want to have your regular vet's contact information. So if you're using a third-party telehealth provider, you want that person to be able to share information back and forth with your regular vet. So have your regular vet's contact information on hand. Also have a list of any of your pet's prescription medications and health supplements, including the doses and the frequency that you're giving them to those pets. And you want to have your pet insurance information on hand so that you can speed up any reimbursements that might be waiting for you. It's also important to collect your thoughts ahead of a telemedicine appointment so that you make sure you share everything that you wanted to share with that veterinarian or veterinary technician. So write down what you were thinking of ahead of time so you don't forget about it in the excitement of the appointment. So it's really easy to forget that one last little question or that one little thing that you noticed about your pet. So write it down ahead of time when everything's sort of quiet and you're not being asked a bunch of questions. So observations that you've had about your pet, questions, concerns that you have, and also ask your family members ahead of the appointment if they've noticed anything funny or if they have any questions. Keep that list handy or even type it up into your telehealth platform. So some of our more sophisticated telehealth providers will have, kind of a form that you fill out ahead of the appointment. So you type all your questions in there, and then that can help both you and your provider to track whether or not those questions have been answered. Just before you're about to start your appointment, make sure you set the stage for a really successful communication with your vet. So choose a quiet room where you can speak and listen easily, and make sure you have privacy in that room. So sometimes the information that you're sharing with your veterinarian is not something you want to share with the whole background or everybody else that might be in the room. Your vet might ask questions about your own health, or they might ask questions about your environment that you don't necessarily want to share with everybody else. So make sure you're in a place where you can be fully open and candid with your vet. Keep your pet nearby. Some consultations are just between human and human, just between you and the provider. But in many cases, they might want to see the pet or examine something that you're talking about. So make sure your pet is nearby in the room with you, and have them on a leash so that you can manipulate them in whatever way or restrain them in whatever way, so the vet on the other end of the consultation can see what they need to see. Make sure you're in a well-lit area. Again, that's going to help them to see what's going on. And keep a pen and paper handy so that you can record any important information that they share. And make sure that the family members who know the pet the best are part of the conversation. So it's really typical in veterinary medicine that somebody might send their pet in with another family member, a child or a spouse, that doesn't know the full details of what's going on. And you really want to schedule your appointment for when the most knowledgeable and most invested person can be part of the conversation. Paying for your telehealth service. So you are fully within your rights to communicate your expectations. You want to, at the beginning of your appointment, tell your vet exactly what you hope to achieve with the virtual appointment so that they can tell you if that's realistic, or they can let you know about whatever limitations are out there. So if you are calling because you want a prescription refill, you probably want to say that right at the beginning of the appointment, because if you're in a telehealth situation where your vet's not going to be able to do that, you're going to be able to get that out of the way right away. So tell them exactly what you hope to achieve. Tell them why you chose a virtual appointment. So they're going to know your own unique needs. So if you chose a virtual appointment because you're too far away or because you're a regular client but that you could not get in to your regular vet because they were all booked up, tell them that information. If you chose a virtual appointment because you're trying to cut costs or you have some other barrier between you and a standard vet, this is important information because they're going to tailor the advice that they give to you to your unique needs. So share that. Speak up if you think you missed any information. So if your vet or your technician is inundating you with all kinds of advice and you think that you've missed something important, they will not mind repeating. So speak up and let them know. Let your vet know if you're going to have any trouble following their advice. So if your vet is giving you advice, for example, they're giving you exercises to do with your pet, maybe some physiotherapy, and you have a physical limitation that's going to prevent you from being able to do that, they might have alternatives for you. So, if your vet's saying you need to pill your cat twice a day and you're like, nope, my cat's not going to allow that, they will have an alternative for you. So speak up about any trouble that you foresee having with the advice that they're giving. And finally, make sure you review your list of questions before you complete the appointment to make sure all of your concerns were addressed. Like I said, you're going to want to communicate your expectations at the beginning. You're paying for this consultation. You want to get everything out of it that you need to get out of it so that you're not disappointed at the end of the interaction. It's good to know ahead of time what kind of questions you can expect from your veterinarian, what kind of questions you might have to answer to help them come up with a plan for your pet. So here's what I would typically ask in any appointment, whether it was physical in an exam room or virtual with a client. I would ask, has your pet been coughing or sneezing? Are they breathing at a normal rate? And are they breathing easily, or do they seem to have some sort of effort or problem there? How has your pet's energy level been? Is it the same? Are they playing normally, or are they quiet and subdued and not doing their normal activities? Have you noticed any recent vomiting or diarrhea? What color are their gums? So pull up their lip and have a look. Are they pink? Are they bright red? Are they paler than you would expect, or white? Or are they yellow? Because these are important things about your pet's hydration and any anemia, any organ diseases as well. Are they eating their regular food normally? Are they eating more or less than usual? And what about treats? Maybe they're not eating the regular food, but they're still interested in treats. I might ask if people could provide a video or a photo of the problem. And this even happens in a regular exam room because pets don't always do what they're doing at home when they get into the vet's office. Has your pet been drinking and peeing normally? Are they drinking more than usual, less than usual? Are they vomiting after they have some water? Are they visiting the litter box more often? Are they peeing in the house? Are they asking to go outside more often? And are they having any trouble or straining when they attempt to go? So these are important pieces of information. I might ask, have you noticed any limping or any discomfort anywhere in your pet? I would ask if they have any lumps or bumps. Are they new? Have they been there for a long time? Are they changing at all? I would ask if there's any other pets in the home and if they're doing anything unusual, because sometimes illnesses can be contagious or sometimes environmental factors affect more than one pet in the house. I would ask if you think there's been any recent change in weight. So weight changes can be gradual, and sometimes looking back at pictures can help you to tell if your pet has gained or lost any weight over the last couple of weeks or months. I would ask if your pet takes any medication or supplements or any herbals or homeopathics or any other alternative therapies. I would ask why they're getting those medications, what their doses are, and when they were last given. And I would ask if your pet has had any serious or chronic health concerns in the past. So it's your vet or your technician's job to give you information, but it's your job to be an active listener. So you can record the instructions that your telehealth provider gives by either writing it down or recording the interaction. You should write down questions that arise during the conversation. You might not want to ask them in the middle of the conversation or in the middle of when they're giving advice, because it could get you off on a tangent or derail, or they might be about to get to that question. So write down the question as they come up and make sure at the end you address all of those questions. You can absolutely ask for alternatives to instructions that you don't think you're going to be able to follow through on. So like I said, let your vet know if any of the advice that they're giving is unrealistic in your unique scenario. And that could be because of cost, that could be because of practicality, any of your physical constraints, or your pet's considerations like their nervousness or their physical restrictions, those types of things. So ask for alternatives. There is always another way to get your pet healthy. There is never just one way. Repeat important details back to make sure you caught them correctly. So if your vet says, I want you to give 2 tablets 3 times a day for 7 days, you should reflect that back to them to make sure you got it right. So you should say, okay, so I get that you want me to give 2 tablets 3 times a day for the next 7 days. And that will give an opportunity to double check that the communication has happened properly. And then finally, ask for an emailed summary after the call. Both your regular vet's office and your third-party telehealth provider should have a way of doing this. And this is just a great way to make sure you hit all the questions and that you are able to follow up on all of the instructions. While telehealth is a great tool for overcoming many barriers that might be in the way of you physically getting to a vet's office, unfortunately, there are some things that just can't be done properly when you're remote. So there are some things that have to be physically done with your pet in the environment of an animal hospital. So try not to be too disappointed if you come up against these limitations, because advice to go into a hospital is always given in the best interest of your pet's health. So there are some things that come to mind that I know just have to happen in an animal hospital. And those would be any illnesses that need to be fixed with a surgical procedure, any situation where you need x-rays, blood tests, or some kind of sample collection like a biopsy. Like I said, in some areas, prescriptions cannot be provided through telehealth alone. So if you need a prescription, you will have to bring your pet to the vet. And this especially applies to controlled drugs. So if your pet needs some sort of opioid or a lot of seizure medications, there are areas where a regular prescription like an antibiotic is fine and legal, but those controlled drugs must be prescribed through an in-person visit. Serious emergencies, if your pet got hit by a car, if they are bleeding profusely, if they are having difficulty breathing, these things need to be addressed in person as soon as possible. Conditions that aren't improving. So if you've had a telehealth visit multiple times for, say, an ear infection or a skin condition, and it's just not getting better with the advice or the prescription that's been provided, you may need to go in so that something physical can be done to help the pet. So keep in mind, when telehealth can't provide a full solution for you, often it can give you information and resources to bridge that time between now, when you're seeing the problem, and when you can reasonably get to the vet. So they might give you information about first aid, they might give you information about nutrition approaches, and that teletriage information in terms of this needs to be seen now, it can be seen tomorrow, it can be seen on Monday, or it can be addressed in your next vaccine appointment. So if you've gotten that information from a telehealth provider and you now need to get fast-tracked to the front of the line at your regular vet's office that's maybe fully booked, you can call in and share that information and say, I've already consulted a vet online. They said this is a 911 emergency. What can you do for me? So that's often an important detail that you can get out of telehealth or teletriage. It can also help you prepare for future visits. So if you are talking to a vet via telehealth about your pet's limp or your pet's ear problem, they might say, hey, this sounds like something that's going to need a really good sedation. It's a painful issue, but we need to take samples. So, we're going to need a little bit of extra time to do that sedation or to do a procedure or to snap some x-rays. When you call your regular vet, you already know this isn't going to be a 15-minute appointment. This is going to be something that they need to plan for in their schedule, and you might get that all done in one go rather than having a quick visit to plan for the next long appointment. And it also helps you to plan for cost, because if you know your pet's likely to need a surgical procedure or some x-rays or some extra tests, you can plan ahead for the cost so that you know how you're going to cover that when you get into your vet's office. An essential part of your telehealth visit is the follow-up piece. So follow-up allows you to let your provider know about your pet's progress, especially if they're not getting better or if they're doing something new or worse. So you need to be able to have that back and forth communication with your provider. You need to be able to let them know if you've noticed any side effects associated with the treatment that's been prescribed. You need to let them know if you weren't able to follow any instructions. So if you had to give a medication 3 times a day, but something has happened in your life where you're not going to be home, you need to let them know so we can adjust the plan. You need to be able to plan any rechecks and whether or not those rechecks are in person or virtual. And then finally, you need your telehealth provider, if they're not your regular vet, to be able to share the records and the advice that was given back to your regular vet so that they have a full picture of your pet's complete medical history and what kind of medication they've been on. So we've talked about some of the limitations of telehealth and telemedicine, and we've talked about some of the conditions that are not appropriate for a telehealth consultation, but let's talk about some of the conditions that do great with telehealth. Some of the conditions where telehealth really helps to get superior medical care to pets. General health and nutrition advice, that is a great situation to consult a telehealth provider. Because the pet doesn't necessarily have to be there. If you're a new pet owner and you need some coaching, you have 20 questions a day about your new kitten and you don't want to bug your regular vet, a telehealth provider would be more than happy to help you with that information. If you want some triage, so you're not sure if it's something that can wait until morning and you're biting your nails and you're stressing out about it, call a telehealth provider. Rechecks for ongoing conditions. And this is even something that's really relevant from your regular physical vet. So if you have an ongoing issue with a pet, especially if it's like a behavioral issue or something like that, you might not need to go in for that recheck or for that ongoing conversation. You might be able to achieve some of those through telehealth. Post-surgery rechecks. If your pet had a spay or neuter and it's typical to have that incision checked a week after surgery, we might be able to do that with just a picture or a video. Mild conditions that started recently. So if you are noticing a skin condition that's new, you're noticing some mild diarrhea, some limping, maybe a little bit of sneezing, you know your pet is not in a dangerous situation, but you want some advice on what to do, telehealth might really help you there. Anxiety and behavioral conditions. So pets that have behavioral conditions like aggression or anxiety, they might not be improved by having to really frequently go into a vet, especially if they have anxiety around strangers. So sometimes we can give you advice over the phone or by video chat that can really help your pet without putting them through an anxious situation. Remote pets. The reality is, especially in our territory, many people live very far away from a veterinarian, and it is not practical to go into a physical clinic every time the pet has a need. So we can really improve the amount of care that these remote pets get by providing telehealth services. And then finally, pet owners that have restrictions. So pet owners that have a mobility restriction, a financing restriction, transportation concerns, all of those things really factor in to whether or not somebody can reasonably get to the vet. So we don't want these pets to not have vet care. We can provide telehealth solutions that can help out. So in the interest of safety, let's review a couple of conditions, again, where telehealth is not ideal. So if your pet has difficulty breathing, if they are experiencing moderate to severe bleeding, if they've had significant trauma, so if they fell from a height or if they got hit by a car, telehealth is probably not your best stop. If they have a surgical problem, so if they have a tumor or some other issue where surgery is going to be necessary, telehealth might not be the best option. If they are having seizures actively, telehealth is not where to go, and most cases of poisoning. So these are all situations where time really is of the essence. You don't want to delay seeing a vet. In the case of these issues, you want to get in as soon as possible, and we're very likely to have some sort of physical testing happening or some sort of physical treatment happening. All of these things are things that telehealth is not going to perform very well on. So just a little recap of the whole presentation. I want you to know that telehealth is a great bridge to the vet in cases where wait times, distances, your physical limitations, and other practical factors might make it really difficult to see a vet in person. And while not every problem can be solved with a virtual visit, lots of pet parents really appreciate the advice and the peace of mind that they're getting by connecting remotely with a vet professional. Some vet clinics offer telehealth services to their customers and clients as an extension of their in-person services. And in those cases, those vets are usually able to do a lot more for those pets remotely. And there are also many independent telehealth platforms that operate outside of a physical clinic that can help you out, especially if you don't have a regular vet. And then finally, pet families can really enhance the value that they get out of their virtual visit by preparing all the tools and information and questions that they have in advance, and by really candidly communicating their challenges and their expectations with that provider that they're talking to. So I want to thank you for your time. I want to thank you for learning about veterinary telehealth with me today. And I want to thank you for being a part of the Pets Plus Us community. If you are part of the Pets Plus Us community, make sure that you explore some of the teletriage offerings that come with your policy. These are some things that can really help you bounce ideas off a veterinary professional and decide how and when you're going to get treated by your vet. Thank you so much. I'll see you at the next one.